اتفضل.
Good morning, my students. Today we are going to demonstrate how to examine the shoulder joint. First, I'd like to introduce my student Abdullah. He is an intern and actually he volunteered to participate in this educational video. Our topic today will be examination of the shoulder joint. The shoulder joint is a synovial ball and socket joint. It is composed of three bones: the humerus, the clavicle, and the scapula. And it is surrounded by a very dense groups of muscles. Three groups of muscles are available. The most important group is a group here which is called the rotator cuff. And if you would like to remember the names of the rotator cuff muscles, it is the supraspinatus, infraspinatus, teres minor, and subscapularis. You can remember them by the abbreviation SITS: supraspinatus, infraspinatus, teres minor, and subscapularis. Now, Dr. Abdullah will show us the normal range of the shoulder movements. Now, flexion, extension, abduction 90 degrees, full abduction, adduction, external rotation, internal rotation. Now, once you find the patient is capable of doing these movements in a full range, then you will ask him another question to demonstrate the range of motion in isolated directions. So, to test for external rotation and abduction, you ask your patient to crisscross his hands behind his neck, something like this. When he is capable of doing this, it tests external rotation, abduction of both shoulders. And then you ask him to put his hands behind his back, full range, and as you can see here, this combined movement, it tests internal rotation and adduction. You can also examine each joint separately in these isolated movements. So, if we are aiming to examine the internal rotation adduction of the left shoulder joint, you simply ask the patient to try to lift up his thumb as high as possible, and according to the height you can judge the full range of the internal rotation and adduction. And for the external rotation and abduction of the right shoulder, you ask him with the right hand to touch his left ear. If he is capable of doing this, this will test the external rotation and abduction. Now, we shall test the movements against resistance. First, we are going to be testing abduction performed by the deltoid muscles against resistance. You ask the patient to put his hands like this, and you ask him to resist as I pull him down. So this is test for deltoid, this is abduction against resistance. And then he will extend his arm like this, putting his thumbs down, and as I try to pull him down, he will resist. This is the action of the supraspinatus against resistance. And then he will put his hand like this, and he will try to rotate his hands outwards as I put my hands. So this is the external rotation against resistance. This is the action of the infraspinatus. So this position, you are trying to pull him down against resistance. It tests the power of the supraspinatus. And the other test here, he is trying to elevate or actually to externally rotate his shoulder against the resistance. This is the infraspinatus. And finally, for an isolated action of the subscapularis, he will put his arm like this, and I will ask him to push my hand. When he pushes my hand against the resistance, this is actually, look at the left shoulder, it is internally rotated. So when he tries to push my hand, I am testing the isolated action of the subscapularis against resistance. One last test, a syndrome which is called the rotator cuff syndrome. You ask the patient to abduct his arm and then to lower it very slowly. If he is having what is called rotator cuff syndrome, as he is trying to lower his arm slowly, he will be unable and the arm will drop. We call this the arm drop sign. The arm drop sign is a sign of rotator cuff syndrome. Thank you, and next time we will be discussing the rest examination.